Good morning, everyone. Let's go ahead and get started. Welcome to our upcoming session on new funding opportunities for peripheral neuropathy researchers. Wanted to introduce myself. My name is Lindsay Colbert. I'm the Executive Director of the Foundation for Peripheral Neuropathy. Joining me today is Patricia Madreau. She is the Program Manager at the Congressionally Directed Medical Research Programs, and she will be presenting today. Also with us is Dr. Amit Hoke. He is the Foundation for Peripheral Neuropathy's Scientific Advisory Board Chairman, and he's also the Director of the Neuromuscular Division at Johns Hopkins School of Medicine. Before we get started, I just want to let everybody know this presentation is being recorded. You will receive the link through email probably tomorrow. And at any point, if you have questions during this webinar, I ask that you submit your questions through the question box in the platform. Currently, everyone is on mute. So in order to ask questions, please submit them through that box. And if at any point you're having trouble with audio, especially with your computer, I'd encourage you to dial in. The dial-in instructions are on the registration email that you received within the last hour. But obviously, if you do have problems, feel free to use the chat box at any time. Let us know, and we will try our best to help troubleshoot. Thank you again for joining. Just a quick blurb about the Foundation for Peripheral Neuropathy for those of you who don't know us. We are here as an international organization to help people living with peripheral neuropathy. We do a lot of things, one of which is advocating for more research funding for peripheral neuropathies. And that is really the main reason why you all are here today. We are very excited that the Department of Defense's PRMRP designated peripheral neuropathy as an eligible condition for research dollars. This year, it is being funded at $370 million. And it's the first time peripheral neuropathy is eligible to receive these funds. So the Foundation for Peripheral Neuropathy is really excited, and we thought it would be a great idea to learn a little bit more about the program and help educate all of you on how the applications look so that you feel empowered to apply. So at this point, I am pleased to pass the microphone over to Dr. Patricia Madreau, who will be leading today's session. Dr. Madreau, thank you again.
Thank you. I'm Patricia Madreau. I'm the Program Manager for the Peer Review Medical Research Program. Next slide, please. And before we begin, I'd like to present a disclosure that pretty much anything that I state in this presentation are the views of me and don't reflect any official policy or position of the Department of the Army, Department of Defense, or the U.S. government. Next slide, please. So the Peer Review Medical Research Program, or PRMRP, is one of about 36 programs within what we call the Congressionally Directed Medical Research Programs, and which is CDMRP. And CDMRP's vision to transform the healthcare for service members, veterans, and the American public, American people, is really accomplished by finding, funding, and very actively managing high-impact, innovative research. Next slide, please. This slide shows some of the hallmarks of the CDMRP, and they're pertinent to peer review medical research program. First and foremost is that all of our programs are targeted research funds. We do not ask for these funds. We do not lobby, and the DoD does not request these dollars or these programs. So Congress actually adds these funds to the DoD budget in the DoD appropriations. What's important that hopefully I can convey to you in the next about 25 minutes is that impact is key. Impact of the research is very, very important and utmost importance to all of our programs. Every program develops its own vision and mission, as well as its own annual investment strategy. And we coordinate with other agencies to complement as well as avoid duplication. And in this particular case, we've been coordinating with the Foundation for Peripheral Neuropathy to ensure that we have the most important and accurate areas of encouragement under the topic area for peripheral neuropathy. In 1993, the National Academy of Medicine, which then was known as the Institute of Medicine, or IOM, provided some guidance to the CDMRP. First and foremost, they recommended a two-tier review of applications. And that two-tier review would include your traditional peer review, which many of you are very familiar with, if being funded or serving as study committees for NIH, but also to follow that peer review with a programmatic review. So the second tier would be programmatic review to make funding recommendations. And that we wouldn't use a pay line based on peer review scores to determine which applications should get funded or not funded, but instead that we would look at the research and make a decision based on how novel is it and how impactful it is. They also provided they provided many recommendations, but the two that I'm highlighting are the two-tier review, as well as including consumers, and those are patients, survivors, or caregivers of individuals with these diseases and conditions for all of the programs that Congress provides to us. For the peer review medical research program, because there are so many different diseases and conditions encompassed in each fiscal year, a consumer is actually described as by all three. And we include consumers in our programs and basically in all aspects, from vision setting all the way through programmatic review to make funding recommendations. And what's important about it is these individuals, they bring an urgency and knowledge that no one else really has about that disease or condition. And we consider them to be the true north. Something that I think is very important for you to know is that we obligate our funds up front. And this limits out-year financial commitments. And this is, of course, with the exception of DoD investigators. So an example is if you're recommended for funding and your award is worth $2 million, although we will not disperse those $2 million up front, and you will actually invoice or against that $2 million award, we will obligate that $2 million so that the project will have all the funds it needs to complete the work. So in subsequent years, that funding will not be decremented, is basically what I'm saying. We are very transparent in accountability to our stakeholders, and the stakeholders don't just include Congress, but also includes foundations such as the Foundation for Peripheral Neuropathy, as well as all of the individuals living with these diseases and conditions. And then something that is very interesting and is that we have very low management costs. Our management costs have not increased since 1993. They do wax and wane between 4 to 6%, but typically our management costs, which we pay for absolutely everything that we do, typically range about 5.8%. Next slide, please. This is the annual cycle that we use. For some programs, it's 2 years. For other programs, we go through our cycle in 18 months. 12 months to 18 months, and it's highly dependent if it's a new program or if it's an existing program. But basically, this cycle includes an appropriation from Congress and the vision setting to basically develop our investment strategy. We then, as a staff, prepare funding opportunities, and each one of those funding opportunities is a specific award mechanism. Then every funding opportunity requires a pre-application receipt. Some of those are letters of intent, and some of those pre-proposal narratives that require an invitation. And then we have full application receipt that goes to peer review for scientific merit, and then followed by programmatic review for funding decisions, or funding recommendations. We then go into actively managing those awards, first and foremost through an award negotiation with our grants and contracts office in your organization. And then we have science officers who will work with you through the period of performance to garner your accomplishments, and often they will follow up with you because we do want to highlight your accomplishments to Congress. Next slide, please. So this is the FY21 funding that has come to CDMRP, and as you can see, there's a variety of different conditions and diseases, as well as a variety of appropriations. And as you can see, the Peer Review Medical Research Program has $370 million as appropriated for FY21 with 42 different topics, and those topics are different diseases and conditions. Next slide, please. So the program, we have our own mission and vision, and we actually developed them in accordance with the appropriation language. We want to improve the health care and well-being of military service members, veterans, as well as all of the family members. And we do that by funding meritorious science that has direct relevance to military health, and that is relevance to, again, military service members, veterans, and beneficiaries. The program began in 1999 as the Defense Health Research Program with about $19.5 million. And to date, we, including FY21, we have had $3.08 billion in the total appropriations. And we've had about 208 different congressionally specified unique topics. And we have funded research in 170 of those unique topics through fiscal year 20. And it's important to note that we do not have any pre-selected allocation of funds per topic area. So we don't take the $370 million and say, okay, we're going to divide by 42 topics, and that's how much funding each topic gets. That's not the way we do business. Congress doesn't pre-select an allocation of funds, and we don't either. Next slide, please. Shown in the slide are the congressional appropriations over the years, and you can see that for many years it was about $50 million, and then 2014 it quadrupled, and we have absolutely no reason why. The number of topics has varied anything from 19 to 20, and more recently between 39 to 52. And again, for this year, it's 42. Next slide, please. These are the topics for this fiscal year. As you can see, peripheral neuropathy is one of the 4 new topics. Topics come and go. Some have been consistent for 10 years, and others are new for 1 to 2 years. Next slide, please. So what we try to do is we try to provide some insight in terms of what are the important aspects for each of those diseases and conditions known as a topic. And what we do is we work within the Department of Defense, the Veteran Affairs. We also work with advocacies and also other relevant stakeholders to develop what we call as areas of encouragement. And those are included in each of the funding opportunities as Appendix 2. And areas of encouragement are just that. We're trying to provide to you as investigators what that advocacy or what the DoD or the VA or the program considers to be some of the top priorities or some of the gaps for that disease or condition. Again, that information typically is not exhaustive, and you're not restricted to submitting an application that addresses an area of encouragement. We fund many applications that do not address an area of encouragement. What's important, though, is that you must address a topic area. Next slide, please. I want to present some of the funding opportunities that the program has offered. So for the last 5 years, these are the funding opportunities that the program has offered, and they are the same for FY21. We actually have had a pre-announcement out that I'll present in a moment that shows you that they are the same. But what's important is that they cover bench to bedside. So these are award mechanisms, and each award mechanism is published as a program announcement or a funding opportunity. So we use award mechanism, program announcement, and funding opportunity as synonyms. So we have a discovery award. It really is supporting high-risk, high-gain research that could potentially change current thinking or current approaches. And it's blinded, so that at both peer and programmatic review, the identity of the PI, collaborators, and all the organizations is unknown. The expansion award, we just started offering it in 2018, and that's to allow us to reinvest in our investments. And again, it's typically open to those individuals that have been previously funded by this program, and each year we specify the years for those eligibilities. We offer 4 funding levels that vary in direct costs, anything from $500,000 to $5 million for varying period of performance. And again, that is because to apply to the expansion award really depends on where the original research began in the spectrum from bench to bedside. We offer what we call the Investigator-Initiated Research Award, and that's not that dissimilar from the NIH R01. Again, we're supporting research that's mature research that will have high impact, and the research can be in animals as well as in humans. We offer a partnering PI option, and that means that there are 2 individuals that work together. They complement and synergistically work together, and they bring something unique to the project. And we allow $400,000 more for the partnering PI option. And what it allows is that both of the PIs receive their own awards. Technology Therapeutic Development Award is a very product-driven award mechanism, and the end result should be near or at an IND, IDE, submission for a drug device, or near implementation for clinical guidance. Over the years, we've increased the funding to $4 million. What we have seen is that in some cases, we've had applications that are very early in the development and other applications that are much later in development. So for fiscal year 21, we're offering 2 options, one for $2 million for early development of a technology or therapeutic, and $4 million for mature or later development. The Focus Program Award, we started offering it in 2014. It supports multiple projects. We ask that the application include about 4 or more independent but complementary projects that address an overarching impactful question. And again, the projects can actually range anything from very basic research such as discovery award all the way through a clinical trial. And we provide $7.2 million in direct costs for a 4-year period of performance. And then finally, we have a clinical trial award, and that supports phase 0, 1, or 2 clinical trials. The application must include an FDA letter of acknowledgement, deemed safe to proceed, or no clinical hold. If not, what we do is we offer a 18-month planning phase for the progression of that research or the regulatory approvals to occur. On this slide, it shows some of the average costs of clinical trials over the past few years. And you can see we have funded clinical trials that have ranged anything from about $250,000 up to about $15 million. Next slide, please. So eligibility. It's important to know that that eligibility is pretty much open. And I wanted to present this slide. It's taken directly out of our program announcements, funding opportunities, that basically says all organizations, including foreign organizations, foreign public entities, and international organizations are eligible to apply, as well as local, state, and federal government agencies within the U.S. So basically, any organization. Now, for principal investigator, it's very specific to the program announcement funding opportunity. And in the same section under eligibility in each of the program announcements, it will indicate the eligibility for the principal investigator. It may also indicate other requirements in terms of other individuals that should be included. But what's important to know is that an eligible investigator, regardless of ethnicity, nationality, or citizenship status, must be employed by or affiliated with an eligible organization. So again, we support many small businesses, companies, but again, that the investigators must be affiliated with some organization. Next slide, please. Deadlines. We typically for this program, we only have one deadline for each of the funding opportunities. And that partially is due because of the vast number of pre-applications and full applications that we receive. This is an example of what you will see for the Investigator-Initiated Research Award when it does get released, and hopefully it'll be, our program announcements for FY21 will be released by the middle of March at the latest. We're hoping sooner, but hopefully by the middle of March. It will list on the front cover of each of those funding opportunities what the pre-application deadline is. If an invitation to submit a full application is required, that deadline will also be included, as well as the application submission deadline. We also have something we call a verification period, and I'll explain that in a little bit, but that also has a deadline. And that gives you some sense of when we anticipate peer review and programmatic review to be done. Just to let you know, there are no grace periods for either the pre-application submission or the application submission deadline. And although I say there are no grace periods, 99.9% we do not allow a grace period, but we are open we are always open to allowing some grace period due to hazardous weather or some national emergency. Next slide, please. So now, next slide, please. Now I'm going to go a little bit over some funding opportunities, and some of this is very, very simple information, but it's important information. So we have a system called the Electronic Biomedical Research Application Portal, and that's actually where you'll be submitting your pre-application. And on the front page of eBRAP, it allows you to subscribe to notifications, and by subscribing to notifications, you'll receive notification when the peer review medical research program announcements are released. Also, as well as any news that we think is deemed important by our Contracts and Grants Office, our Office of Research Protection. And you'll also get information about pre-announcements, and you can select as many programs or as few programs as for which you want to receive that information. You can also subscribe on our CDMRP website. And I would encourage you to subscribe. You can automatically do that if you register as a PI, but if you just want notification without registering in eBRAP for pre-application, full application submission, then you can just subscribe without registering. Next slide, please. So one of the things that we do early on is after we've had vision setting and after we know that we have had, or we have pretty certain what we have for an appropriation, we release what we call a pre-announcement, and that's what's shown on the top of this slide. And there's as you can see, there is the URL for accessing this pre-announcement for the peer review medical research program. And each of these pre-announcements, what you will see is the topic areas that are specified by Congress, as well as the funding opportunities that we plan to offer for that fiscal year. And again, you can receive this information by subscribing to notifications in eBRAP. And also, prior to actually releasing FY21 program announcements, you can get a glimpse of what those award mechanisms look like and the different types of application components, pre-application components, as well as full application components are required. And the way you can do that is you can go onto the cdmrp.army.mil website, and under funding opportunities, there's something called Program Funding Opportunity Archives. And I show on this slide, the bottom of this slide, I actually show the URL for that link. And you can look at FY20 as well as since the inception of the program. I will caution you, though, that you really need to pay attention to when the actual fiscal year 21 program announcements are released, because we do make some changes between previous years. For example, the Technology Therapeutic Development Award now has two funding levels for FY21, whereas it did not for FY21 in earlier years. And the Clinical Trial Award mechanism has a pre-proposal for FY21, whereas it had a letter of intent as the pre-application for FY20. So again, the difference is for FY21, the pre-application is a pre-proposal that will get reviewed, screened, and invited for a full application. Next slide, please. So this is how you can search for funding opportunities. Again, mechanisms are posted as program announcements, funding opportunities, and you can find those at the CDMRP.ARMY.gov website as well as at eBRAP, and also you can search in Grants.gov. And for all of our program announcements, there's also something called a general application instructions, and those are really important to read, both of them, because the general application instructions, which we call GAI, provides information in terms of some of the different forms that are requested. Next slide, please. So I'm going to go real quickly through some of the strategies to success. Next slide, please. And some of these may seem very simplistic, and I really apologize, but what's really important and what sets us apart from other funding agencies is that you need to understand the goals of the program, which we do provide some information in the program announcements, but it certainly would be useful for you to visit cdmrp.army.mil and look at the peer review medical research program. But it's also very important to understand the intent of the award mechanism, as well as the review criteria. Next slide, please. So one of the first steps that you have to do is you need to submit a pre-application eBRAP. It's required for every single one of our funding opportunities. Again, there's a letter of intent that it doesn't get reviewed, and there's no invitation required for application submission. And for FY21, the Peer Review Medical Research Program Discovery Award mechanism is an LOI. So you can move from submitting that LOI to directly submitting your full application to Grants.gov. A pre-proposal is reviewed, and the invitation is required for application submission. And this slide shows you the different award mechanisms that uses the pre-proposal submission for FY21. Again, read the funding opportunity carefully, and if there's any options, please be certain to choose the correct option. And again, start the process early, because we do not have any grace periods. Next slide, please. This is an example of what a pre-application might look like. On the far right is really what you'll see for all of our peer review medical research program funding opportunities. Again, the pre-application files will be specified in each of the program announcements, and it does vary between program announcements. And you'll be uploading different documents. My recommendation is, if you plan on submitting to us, is for you to register in eBRAP, get affiliated with your organization, because you need to be affiliated with your organization in order to review and make modifications to your full application in eBRAP. And you can follow any of these tabs that are shown 1 to 5 in any specific order. So again, I would start by registering in eBRAP, and then when the program announcements come out, once you decide which program announcement that you'll be submitting to, I would begin. Next slide, please. Again, read the program announcement. Their award information provides the intent of the award as well as the key elements. And so, what do we look for? So again, I'm going to say the same thing for the full application, don't just read the pre-application requirements, also read and address pre-application screening criteria. Again, I think it's a trick that's really useful early in a career to learn is don't just provide in an application or in a pre-application what your research is about, but make sure you actually address how the reviewers are going to be reviewing or screening your pre-application or full application. Next slide, please. So for the Discovery Award, again, it's a letter of intent. You can automatically submit your full application to Grants.gov. For the others, again, you have to have an invitation. But as many of you know, that it's actually a sponsored programs office or equivalent that submits to Grants.gov. Again, please adhere strictly to the program announcements requirements and application submission. No extension of deadlines unless a national emergency, so no grace periods. So please start and be on time. Next slide, please. So something that many investigators don't really take seriously or use to their advantage. We have something called an application verification. So once eBRAP retrieves and processes your application from Grants.gov, it is posted in eBRAP, and you'll be sent an email notification from eBRAP telling you to go, that we've received your application, for you to go in and review it. And unfortunately, we have so many investigators that just don't. So what does the verification allow you to do? It allows you to review and modify every single component except for the project narrative and the budget. So that means if you have forgotten to submit a piece of information, you can actually do that during the verification period. So what's important, though, is you need to be affiliated with your organization in order to be able to go into eBRAP and do this verification. And as you can see on this slide, there's a red box indicating what is missing or what is over the page limit. And again, that is something that will also be sent to you in the email. So again, please take advantage. This is an opportunity to fix something that you may have been too quick to submit. And also, too, we know that since the sponsored program office is the one that's actually submitting on your behalf, sometimes some of the application components are not submitted to Grants.gov. It's important also to know that your names and emails in the application must match those in the pre-application. So if you've registered in the pre-application in eBRAP as johnnyjones@gmail.com and your organization is sending it from johnnyjones@thisorganization.org, then we'll have to manually process those and actually communicate with both you and your organization. So again, please make sure that all of those match, and definitely include your eBRAP log number from the pre-application. Next slide, please. Some of the pitfalls are pretty easy. We do not allow programmatic panel members for the program fiscal year to be included in any part of the application. You can receive anatomical substance or resources for them, but they can't be part of the research. Again, do not exceed page limits. Check files after creating PDF version. Again, submission deadlines. And again, the only thing that you can't correct during the verification period is the project narrative and the budget. These may seem very simple, but really they're very critical. Next slide, please. What I want to do is speak relatively quickly about our two-tier review. Again, the first tier is your traditional peer review. It basically is assessing the technical merit, and it's based on an ideal application. So the peer reviewers are not allowed to compare applications. What they do is they review your application based on the peer review criteria published in each of those program announcements. So each funding opportunity program announcement has a different set of review criteria. So like I said earlier, read what we're asking you to submit, but also read how you're going to be evaluated by the peer reviewers. And also note that we don't allow any contact between you as an applicant and the reviewers, and we can't, as a program staff, help you decide which funding opportunity to apply to, or nor can we say yay or nay in terms of whether the research is good. Again, the peer reviewers consider not only lab scientists and clinicians, but also patient survivors and caregivers, and we don't have standing panels. So what we do is we match your application to the expertise of the peer reviewer. The outcome from peer review is a summary statement, and regardless whether or not you're recommended for funding or not recommended for funding, every application receives a summary statement. Next slide, please. The second tier is programmatic review, and I have put the words comparison-based in large font. And that's exactly how it works. So instead of funding down a pay line, we actually look at portfolio balance. Again, the applications are compared. So let's assume you have 20 applications submitted to peripheral neuropathy, and those applications will be compared during programmatic review. When we're looking for strong scientific merit, which is guidance given to us by Congress, but also, does this application adhere to the award mechanism? How innovative is it? Is it the same old, Are we going to get nowhere fast? But more importantly, impact. How impactful is it? And if we're looking at these 10 applications, which 1, 2, 3, 4 are the most impactful? And again, relevance to military health, Is it impactful to the military service member, their family members, or to the veteran? Again, there's no pay line. And also to let you know, we do not have continuation funding. We do have the expansion award, which is to reinvest in our investment, but that's highly competitive and it's not considered to be continuation funding. So again, peer review, looking at scientific merit, using the peer review criteria published in the program announcement, programmatic review, comparison-based, comparing applications. Next slide, please. Some strategies to success, again, for our program, looking at the relevance to military health, impact. In addition to stating what the impact is in this impact statement, the proposed research should really be demonstrating how impactful it is. Innovation is very, very important in the Discovery Award. We don't want to fund an incremental research. And again, feasibility. It's always important to demonstrate how appropriate the cell line is or the animal model is, as well as the availability and accessibility to all of your critical resources. Next slide, please. Again, planning, timing. I can't speak enough to deadlines. Grantsmanship. We request a lay abstract, impact statement, and relevance to military health statement. A lay abstract, when we ask for a lay abstract, remember that that's the abstract that's going to the consumers. That is the lay person that's helping evaluate your proposal at peer review. So definitely try to put it in layman's terms. And again, understanding the goals of the program and the intent of the award mechanism. And again, we can't say this too frequently, and that is know your audience. Again, we're different, and that peer and programmatic review include bench scientists, clinicians, patients, survivors, and caregivers. Next slide, please. And on our website, cdmrp.army.mil, we have an URL at the bottom of the slide. We actually have a webinar series that speaks to different funding opportunities and some of the strategies for success. And as you can see on the right-hand side, we have multiple webinars to address many different areas that we think are important. Next slide, please. If you need more information on the peer review medical research program, again, you can visit our website, and we have lots of information about CDMRP. Thank you very much.
Thank you so much, Dr. Madreau. We really appreciate it. I'm Lindsay Colbert. I'm the Foundation for Peripheral Neuropathy's Executive Director. And, you know, we did receive one question that came through, and I'm not sure if you can speak to it, but I figured I might as well ask. You know, obviously there are some etiologies of peripheral neuropathy that may be more directly related to DoD veterans, such as injury or alcoholism, than others like chemotherapy-induced peripheral neuropathy, idiopathic peripheral neuropathy. So can you speak to how or if the Department of Defense prioritizes the former, or would either be similarly competitive or for the funding?
We do not prioritize. Again, you know, it's all about personal readiness. So Congress gives us, again, the terminology, high scientific merit and relevant to military health. The majority, I'm going to say at least 90% of every fiscal year of the topics or diseases and conditions really are focused on the family member or the veteran, more so than directly impacting the military service member. But many of them do, and in fact, probably all of them do indirectly affect the military service member because it affects their family member. So there is no priority given. Again, it would be when we look at how impactful something is or do a comparison, it really is on the population that's proposed in the application. It has to be impactful, not just on that disease or condition and moving the field forward or moving patient care forward, but also impactful on that population being proposed to be studied. Okay, thank you. Another question that just came in, we have someone who's watching right now who's associated with both the VA and a university. Do you have any recommendations on how they should affiliate themselves on their application? I really can't tell you what is the best way to do. We've had investigators do it both ways. It doesn't make a difference in terms of whether or not you're going to be funded or not. But I can tell you that when we do our review and analysis, I do report out what type of funding goes to the VA and what type of funding goes to what we call an extramural organization, as well as to DoD organizations. To tell you the truth, it runs about the same. It's about 14%. It varies from year to year, but anything from, I'm going to say 13 to 15%, depending on the year, and then also the quality of the applications. One of the things that we do and that we would ask, though, is that if you do want to submit through your organization, your university, that you do let someone in the application know, or even if you're recommended for funding, letting your science officer know that you also have an affiliation with the VA, again, because it allows us to capture that statistic. And you do know that if you do go through the VA, that you will need to submit not directly from your VA organization, but also through one of the NAVREP organizations that submit on behalf of the VA.
Okay. Now, kind of getting back to some of the causes of neuropathy, can you speak to, I mean, obviously, idiopathic neuropathy is of an unknown cause. It's a very under-researched area of neuropathy. Can you speak to whether or not idiopathic neuropathy might be an area of encouragement for this?
It could be.
Okay.
So we're working on those areas of encouragement, and we expect to have those completed today.
Sure.
For almost all of the different diseases and condition topics, and we'll actually be working with you to make sure that we're using the correct terminology and posing the most important questions.
Perfect. Yes. So just as an aside to everyone that's watching, yes, the Foundation for Peripheral Neuropathy is helping to make some recommendations on gaps and areas of encouragement for this, so that we are sure that the funding goes to the right spots. So,
yes.
So I appreciate that.
Well, that's something that we do with all of the advocacies that reach out to us, or if we know who the advocacy is that has actually lobbied for that topic.
And kind of switching gears, obviously NIH has fixed deadlines for grants. You know, it's the same time of every year. Does the Department of Defense also have similar fixed deadlines that we should keep in mind?
No, the deadlines are on the covers, front cover of each of the funding opportunities. Again, we are so tied to the congressional appropriation that the best we can do is put out a pre-announcement as soon as we're allowed, and the guidance we get every year really differs whether or not we can put out a pre-announcement or even program announcements prior to the signing of the appropriation, or even release of a pre-announcement. So every year it changes, and every year we try to accelerate the process, not take away from the amount of time that the investigators have to prepare either a pre-application or full application, but we try to accelerate the process while maintaining quality for pre-application screening, as well as full application review and at peer review, as well as programmatic review.
And would you find it helpful for researchers to include patient advocates in their applications?
I think it's dependent on what they're proposing. I don't think it necessarily makes a difference. I haven't seen it make a difference for peer review medical research program. And for some of our other programs, it's actually, depending on the award mechanism, it's actually mandatory, but it's not mandatory for any of the program announcements for peer review medical research.
Okay. And just to confirm, anyone can apply for these applications, including people outside of the United States?
Correct.
Okay.
Yeah.
Great. And is there any effects on eligibility? One person's saying that they have a seed grant that's gotten started on that has gotten them started on a project for peripheral neuropathy. Would that affect their eligibility if they wanted to apply for these funds?
I'm not sure what's meant by that. If there's overlap, then and they're recommended for funding, then what we would do is we would work with the organization and the principal investigator to delete any overlap.
Okay, great. Is it a safe assumption that all neuropathies are available for funding, including inherited neuropathies?
If it falls under the definition of peripheral neuropathy, yes.
It qualifies.
Again, the areas of encouragement will just be that, areas of encouragement. We for many years, even having areas of encouragement, we didn't have many investigators actually address an area of encouragement. We've seen more of that over the past few years, but again, we're looking for the best science, something that will make a difference.
Great. And are there any limitations on a specific organization or institution that could qualify for this? Are there any? No. So
there's no limit for our program, for the peer review medical research program. There's no limitations on the number of applications that can be submitted by an organization, and there's no limitation on the number of applications that can be submitted by an investigator, either as a PI or as a collaborator.
So everyone is eligible? Yes.
There is one caveat, and that is submission to the expansion award is limited to the one original award that PI would have had.
Okay.
But that's a caveat. But all the other program announcements are open to all organizations, all PIs, and they can apply as many times as they feel free.
Great. Well, this is really exciting. I know on behalf of the Foundation for Peripheral Neuropathy, we're really excited that we're included in this bill. We really hope that our researchers will take advantage of this. We'll follow all the deadlines and the strict rules that you've kind of shared with us here today. So again, I thank you once again, Dr. Madreau, for all of this. Joining us right now is Dr. Amit Hoke. I wanted to turn the microphone over to him just to see if he had any closing statements or highlights to round us out. So thank you, and Dr. Hoke, please.
Thank you, Lindsay, and really to the Foundation for advocating for this, and Dr. Madreau for sharing the information about the DoD's funding mechanisms. I really encourage all of my colleagues who are listening to this webinar to think about interesting scientific questions and apply for this funding opportunity. We really need to see more peripheral neuropathy related research. Thank you.